Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Welcome back to medical junoon lecture. Today we will discuss about the development of nose. Now let's start the development of nose. In this video we will only discuss the nodes of development of nose. In the second video we will discuss about the diagrammatically the development of nose. Okay. Now development of nose is starting at fourth week of developing stage. Okay, development of nose is starting at fourth week of developing stage. Okay, during the fourth week of development, the ectodermal thickening is produced in front of frontonasal process. The ectodermal thickening is produced in front of frontonasal process, which is called nasal placoids. Okay. After this, lateral and medial swelling. After this lateral and medial swelling. Is producing around the nasal placoids, and the nasal placard change into nasal pits. Okay, and the nasal placard change into nasal pits. After this, lateral and medial mesenchymal swelling is produced around the nasal placard, and the nasal placard change into nasal pits. Okay, now nasal pits move or invaginate dorsally ventral to the forebrain and change into nasal sacs. So this nasal sacs will be changed into nasal cavities. Okay. When the nasal sac move backward or invaginating toward the forebrain, on the lateral side of the forebrain, they change into nasal sac. Now nasal sacs is separating from the primitive oral cavity by oronasal membrane. Okay, during the end of sixth week, the oronasal membrane become ruptured, and the communication is producing between the nasal sac and the primitive oral cavity. Okay, nasal sac change into nasal cavities. Okay, temporary the epithelial plug is producing in the nasal cavity, which is disappearing at 16 week. Okay, ectodermal epithelium is changing into olfactory epithelium. Okay, in the roof of nasal cavity. Some epithelial cell is changing into olfactory receptor. This is the frontonasal processes. In this frontonasal process, ectodermal thickening is produced called nasal placard. This is the nasal placard, 1 and 2 in number, and this is the frontonasal process. Around the nasal placards, mesenchymal swelling is producing. Okay, as a result, nasal placard change into nasal pits. Okay, this is the nasal placards here, and here mesenchymal swelling is producing. Okay, after this, nasal placard is changed into nasal pits, and lateral nasal prominence and medial nasal prominence is producing due to the proliferation of mesenchymal cell around the nasal placard, and this nasal placard change into nasal plaque. This is the lateral nasal prominence, this is the medial nasal prominence. After this, nasal pit change into nasal sac. This is the nasal sacs, this is the lateral nasal prominence, this is the medial nasal prominence. Nasal pit change into nasal sacs when they move backward or dorsally, ventral to the forehead. Here is forebrain or forehead. Here is forebrain is present. Okay. This is the nasal sacs. Okay, nasal sacs. This is the primitive oral cavity, and between the nasal sacs and primitive oral cavity, membrane is producing. This is called oronasal membrane. This is a junction. This is a space. This is a barrier between the nasal sac and the oral cavity. Okay. Slowly and gradually this membrane disappear. Okay, when they disappear, this is the oronasal membrane, this is the nasal sacs which will be developed into nasal cavity. Okay, this is the primitive oral cavity. Okay, after at the end of 6 weeks, this oronasal membrane rupture, and a communication is producing between the nasal sacs, mean nasal cavity, and the primitive oral cavity. Okay, this is the diagrammatical representation of development of nose.